Hey everyone, it's Mayor Hamoud, and we are here this week with our Public Health Department and Public Health Director, Ali Abazid. We're going to talk to you about what public health does, but it's not your traditional public health department. So Ali, I'm going to turn it over to you. Talk to us about what public health does, what the fundamental principles are of this department, and how it operates throughout our city.
Yeah, so as the mayor said, we're really excited that we became just the second city in the state of Michigan to have a formal health department, but we do things a little bit differently. What we do is what's called health in all policies. It's this big word, which basically just means collaboration across all departments in the city. How do we help other departments make more health conscious decisions? But we also do a lot of programming. We have helped install rain gardens across the city of Dearborn. We have a Narcan vending machine at the Dearborn train station. We've installed 10 air quality monitors across the city. We've done a range of things. We responded to the baby formula shortage a couple years ago with our own giveaway. And so the way that we're redefining public health and the ways in which people should be thinking about public health, which is how to make you live the healthiest life.
I, as a Dearborn native, was a perfect person for the job to help ensure public health permeates across our cities. And so you'll go on a tour with him and with his staff to talk about all the initiatives and programs that they're working on that you may not know about in this edition of Working For You.
So continuing the tour here at the Public Health Department, when we launched in April 2022, it was just me. 16 months in that we finally got the first staff members in the Department of Public Health. Next is Sarah. She's the Public Health Advisor for the department. She works cross-collaboratively with all divisions in the department, but also with other departments across the city of Dearborn. Sarah, talk a little bit about what you do here for the department.
My role consists of everything, really, just the operational standpoint, really implementing health and all policies across our department, other departments, and even with external partners across the city, which is really exciting and really fulfilling in that way. And now we're in the phase where we're getting into data analysis and figuring out what are those pertinent measures and needs in the community, and what can we do as a department, as a city, working with our partners to address those needs. But then, a lot of it consists of research and looking into what are other cities across the nation doing to address similar issues that we experience, and how can we kind of emulate those efforts and do something that addresses the needs of Dearborn community. There's just so many exciting opportunities out there, and it's just a matter of looking for them and meeting with the right people to get those things going, so it's great.
Next, we're going to talk a little bit about how we make the decisions that we make. We put a lot of emphasis on data and evidence, and so next we're going to talk to our data scientist, Hayat.
Our department is very innovative, so we use data to help improve services for the city of Dearborn. For example, we have our Narcan vending machines across the city, and so we use geospatial analysis to identify where are the best areas to put these vending machines at.
So interesting little connection. Hayat was actually one of the first fellows in the Department of Public Health. She was one of our data fellows. And what she and another fellow did is they took actual paper records showing where the city of Dearborn was experiencing opioid overdoses, for example. Taking those paper records, they were able to develop a map that allowed us to place the Narcan vending machine at the Dearborn train station. That was a data-informed decision. And so we have a great team here at the Department of Public Health that's working on your behalf every day. And what Sarah mentioned earlier is exactly right. We look for examples all across the country and even globally. What works in other places? How do we bring it to Dearborn on your behalf?